Hello everyone, welcome back to my channel. Today I'm going to resuming the topic of boundaries from Cmpa website. As you can see, we are on Cmpa website, and if you are going on the educational and event topic, you will find good practice. This is a very important part for Mccqe1 exam. I have already uploaded my video on professionalism in part 1 and part 2, as well as the boundaries in part 1. I'm going to continue reading the second part of this topic. What is boundary? If I briefly tell you one in one sentence, it would be whenever we are in a therapeutic relationship with our patients, we have some boundaries which we need to follow. So in that way, we are not taking any kind of benefit from that relationship, and patient is being equally and ethically treated. If we talk about crossing the boundaries or violation of a boundaries, these are the two main things which we look for. Number one is crossing boundaries. Crossing boundaries is not something very uh, problematic at some point, because you are not trying to do anything which is giving a disadvantage to the patient and advantage or gain to the physician. Here, as if we talk about accepting a baked cookies from a patient who were suffering for a long time, you help them to improve in their quality of life, that's still boundary crossing, because you take something from them, but it doesn't mean that you are violating anything. But if you do continuously or time to time crossing the boundaries, then there will be a sliding slope where we will say, okay, instead of going into the crossing boundaries, now you are going into the boundary violation. Boundary violation is the word itself says something. That means you are violating the relationship, you are crossing the relationship in a way that it is getting harmful to the patient. Let's suppose if you are trying to excessively disclosing yourself. Excessively disclosure means you try to tell everything to your patients, whatever is going on with your life. Just a one or two lines, oh, you remember I had this type of situation in the past, or my family member had this type of situation in the past, but they were able to cope up with this one. I think it will be very beneficial to you. So that's not a self disclosure excessively, even though that's a self disclosure, but very minute. But if you try to self disclose everything to the patient, you're basically trying to involve the patients in your life unintentionally. That is also a violation. The most important things which we discuss here, or you get a scenario, is getting an expensive or inappropriate gifts. Expensive and inappropriate means getting a baked cookie, it won't be expensive, everybody know, and it is not inappropriate, because a 70 years old lady can give it to the 40 years old physician, a 30-year-old lady can give it to the 76-year-old physician. But the only thing is, when you are trying to get an inappropriate gift, means that give a signal to the patients that doctor is giving more favor or trying to be more in a situation that in future there might be a relationship outside the therapeutic. Let's suppose if someone give you a chocolate or a rose, that kind of situation can lead to a signal that it might go into the romantic relationship or sexual relationship later on. So that is called the inappropriate gift. Even rose is not expensive, but you accept a rose once, and they are giving you or offering you every time similar kind of a thing. That means that is going from boundary crossing to the violation, because that is giving a signal to the patient that there might be something we can do outside the therapeutic relationship. Third most important thing is talking about intimate examination. Whenever there is examination of a breast or a perineal area of a male or female, or the anal region, it's very important that we do consent, because sometimes patient doesn't feel the way they are being treated, and they feel that uh, they have been experiencing some kind of assault from the physician. So that's why these type of things are very important, that will give you an idea that either you are doing a boundary violation, or you are doing a properly way to not to cross that kind of boundary, or going into a boundary violation. Because whenever there is a boundary violation, most of the time these situations goes in the liability, and the college of regulated authority has to manage things, and they don't accept these types of things when happening in a therapeutic relationship. Whenever I say relationship, that means we're talking about physician patient relationship. That would be a therapeutic relationship. You are a physician, he or she is a patient, they are coming here for help. You are providing them every benefit in terms of therapeutically managing them. You're not going to do anything outside the therapeutic financial gain, any kind of personal relationship, any kind of favorism. You cannot do that. So this is called relationship, which is basically a therapeutic boundaries. I have already discussed all of this in my previous video. If you haven't watched it, just go and have a look. It's very important that you understand these paragraphs, because once you know what the paragraphs are saying, you will be able to answer the questions which are coming in a scenario based. The question of MCCQE1, till today, in my knowledge, it never came like a sentence. It's always come in a scenario based, and you need to understand that how the ethical system works in Canadian healthcare system. So if you don't know what to expect, it is very difficult to answer a questions, because most of the options will look similar to you. But if you have an idea what the CMPA is asking to do or follow to do, it will be easy for you to select the and choose the correct option. I'm going to the third one, which is the today's main topic, and the fourth one, slippery slope. So respecting boundaries, intimate examination. This word itself tells you a lot of things. That means any kind of examination you need to do to provide the diagnostic, to provide the help, to provide the treatment to the patient, and it should be always in a knowledge of a patient and agreement of the patient. Patient says, no, I don't want to go for the breast examination, even though she has a breast mass or nipple discharge, we won't do it. We can go with the other things. We can try to explain a lot of other options, but we will not force the patient that, okay, if you are not allowing me to do the breast examination, I'm not going to do anything for you. No, that's not applicable, because you don't know the previous history of the patient, her childhood, her trauma history. They might get triggered by the previous kind of assaults in their lifetime. So that's why they are not comfortable, or they might have not have enough faith and enough belief on the healthcare systems. So intimate procedures and examination, it is common. If you remove this not uncommon, I used to say common, it is a common for physician to face allegations that have been violated a boundary while performing intimate procedures or examination. For example, gynecological examination. I mentioned that gynecological examination in females, as well as the breast examination, as well as in males. If you talk about any kind of examination related to the genital parts or the anal parts, these all come as an intimate examination. This apply to all physicians, irrespective of physician or patient's gender or sexual orientation. That means a male patient can't do the examination of a male patient. Male physician can do examination of the male patient, and female physician can do examination of the female physician. It doesn't mean that the female patient or the male patient will not give any allegations to that physician. This is not about gender. This is about patient and physician. No matter what gender, what sexual orientation patient or physician are, it is important not to assume that patient will be comfortable with the intimate examination simply because they are of the same gender as the physician. Even though you are talking about pap test to a female patient, you are a female doctor, you still have to explain each and everything before you take, okay, are you okay, or are you feeling comfortable, we can proceed with the procedure or no. That means you have to explain each and everything in a very simple and non-jargon way. So that kind of a thing we have to explain. While some boundaries violation may be deliberated, many are unintentional. Many patients have been experiencing trauma, including sexual abuse in their past, and may find these types of examination particularly difficult. Knowing your patient and being mindful of such issues, taking the time to explain the nature and the purpose of the examination, and seeking consents are very important. Three things whenever you do any kind of this examination. Number one, you need to explain the nature of the examination. What kind of examination you are going to do, what kind of things you're trying to see, and how the examination will be procedure. It will be any instrumental, it will be just your hand exam, it will be any kind of visualization, what kind of nature it is. Number two, the purpose. That means, is it helping you in any diagnostic or no? If it doesn't help, then there is no need to do it. Number three is seeking consent. Written consent is not necessary, but at some point of time, taking an implied express consent is very important. that you at least ask, are you okay to do that? So you can document that examination started by taking the express consent of the patient. To minimize the misunderstanding during the intimate procedure and examination, physician should explain why any question of sexual nature are being asked. That means if you are talking about a patient, someone comes for the HPV vaccination, Gardasil 9, and you are trying to ask, oh, do you have a partner? Are you being sexually active? Have you ever had any kind of STI infections? So basically, we are trying to see if this patient expectations for our Gardasil, because most of the people think Gardasil will help you in just a cancer, but it's not basically the cancer, it's basically preventing the infection, which is the most common and the cause of the cancer. So that's the thing we have to look for. So we need to understand the thoughts of the patient by asking some of the questions, and when you are asking some of the question, you need to explain why you're asking it. If you're asking, do you have a partner, are you sexually active, you need to tell them, signpost that I'm going to ask you a couple of questions which will be personal to you, but it will help me to understand how can I help you more, or what are the things I need to tell you regarding Gardasil, as well as the benefits of the vaccines. Advocate and clearly explain to patients a procedure or examination and why it is performed. As we already mentioned, the nature of the procedure as well as the purpose of it. Obtaining patients' express informed concern for a sensitive procedure or examination by asking if it is okay to proceed after explaining what you will be doing. So our main target is, whenever we take a history, we know that we have to do a breast examination of the patient, because patient is containing it's a mass. So we have to look after if the mass is having irregular borders, regular borders, what are the texture of the that there's a discharge, what's the location, how large, everything. So you have to explain it. Then you do the tell the purpose of the examination, then you ask for a consult, and then you will proceed once the patient says yes. So this is all the things we need to do. Inform the patient the examination will be stopped upon request. Any examination, even you are in the middle of the pap test, patient says no, I don't feel comfortable, you can stop it right away. You don't have to force the patient, oh, it's just a 2 minutes, I'm finishing it. No. If palpation is involved, when not warn the patient prior to palpating or touching the area. Whenever you are touching the area of any abdominal part, any kind of part, even, you have to say, okay, I'm going to touch this part, let me know if you feel any pain or any sensitivity, or you want me to stop it. Given the patient's privacy to undress and dress, that's very important. Sometimes we say, oh, we are already seeing the patients as being doing the pap test, so they can become undressed or dress in front of us. No, you always have to give the privacy, even though you are in room or outside the room. If you are in room, you have a curtain, you can put it. If there is no curtain, you can go outside and knock the door before you enter. Avoid moving or removing a patient's clothes without express consent. If, let's suppose, patient is lying on the table, you did a superficial examination without looking at the things, and you was like, okay, can I take this shirt a little bit up to see if there's anything which I can see underneath on the abdomen or somewhere. So that's the one thing you need to do, and that's without express consent is not good. You have to ask them before you do it. Usually they do it by themselves. If you tell them, can you just pull up your shirt up or something like that, but don't do without express consent. Providing appropriate draping, and this is the one thing, when we are doing a full abdominal examination, we will try to provide the draping to the below the inguinal region, so that we don't feel anything that we are going to touch the pubic or the perineal areas, because that's not included in our abdomen. So that kind of thing. Document any steps taken to specifically address the patient's concern about the procedure and examination. Everything should be documented to save yourself in future. Offer a chaperone. Chaperones can offer protections and comfort for the patient and provider, particularly during sensitive physical examination. Be aware of and follow your provisional regulated authorities policy of offering and providing a chaperone. Chaperone could be anybody. It could be nurse, it could be medical officer assistant, it could be anybody in your staff, which can just stay there to calm and to say that if in any case there is kind of an allegation or happening, so chaperone can be the one of the witness that yes, this kind of thing not happen, or this kind of thing was happen. So chaperone is for your own safety and for the comfort of the patient. Be aware and to follow your provisional regulated authorities. That means you need to know wherever you are working what kind of things you need to provide while you are offering a chaperone. Be aware or to follow your hospital policies around offering and providing chaperones. Definitely, if someone you are talking about a female patient's pap test and you are on offer chaperone, you need to tell them that the Hujat chaperone will be male or female, what their role in the hospital, and what they're gonna do while staying in the room when I'm doing the pack test. If they say yes, then yes, you can do it. If they say no, I don't need it, I'm okay with that, so then you can proceed without chaperone. While consent may be implied when a member of a clinical team, could be nurse, in both assisting the examination and acting as a chaperone, obtain express consent when the chaperone's only role is that to observe. Let's suppose chaperone is for the moral support of the patient. You need to tell them it won't help me in any way, but it is just for your comfort, and if you feel anything, or is there anything you're concerned, then staying of a chaperone in a room would be great. So that kind of thing, because they are not going to assist you in any kind of procedure, you are doing the procedure by yourself. Select a chaperone. Generally a chaperone should be trained physician, medical professional. It could be nurse, it could be someone, because it is easy for them to understand what's going on. But it's not something mandatory. It could be anybody. If a trained healthcare professional is not available, non-medical staff, which is like an office assistant, receptionist, may be substituted with the patient's consent. Some colleges offer training courses for office staff to help them understand their roles and responsibilities as a chaperone. If you're considering using non-medical staff as a chaperone, you will want to investigate any chaperone training resources available through your college or medical professional association. Let's suppose someone is working in a clinic, they want their medical officer, the receptionist, to be the chaperone at any point. If they need, they can provide some resources to them, so that at least they will understand what their role will look like. Discuss with your staff the role and expectations of them as a chaperone, especially the need to respect patients' dignity and privacy. In some cases, it may be reasonable to suggest the patients bring a person of their choosing of examination, particularly when you do not have the resources to offer a chaperone. The patient should be notified at the time of booking of a sensitive examination if you are unable to provide a chaperone. Let's suppose you are booking someone for the pap test. You can tell them, if you want someone to be with you in the room, you can bring them. We don't have an issue, but we don't have a chaperone to be helping you in that anyway. So if you're okay, you can bring your own if you need it. So that's also one thing, that giving a broad option to the patient for their comfort while the procedure is going on, it's very great. Some patients may wish to have a family member or friend present during the exams. In addition to any chaperone you offer, you should generally comply with any reasonable request when possible and feasible. If you feel that mother can stay in a 25-year-old female pap test and you're already offering a chaperone, she wants a chaperone but she wants her mother to be there, that's okay. Consider, however, that not all friends or family members will be impartial or might not fully understand the purpose and the steps of examination. Then it depends upon request to request. So, if I talk about Mccqe1 examination, you will need to understand that a patient can bring itself their own family or friend in terms of providing the support, then you can say yes, but it should be always reasonable. A female patient doesn't want someone from the colleague or something to stay in the chaperone. You would say no. I don't feel that these types of conflicting questions coming in the exam, but at least you should understand that patient can bring their own family members or friends for their comfort, even though you're offering a chaperone. So that's the only thing you need to understand. But we never know what kind of exam questions can come, so it is better to understand in terms of offering a chaperone what are the important things. If a patient refuses a chaperone, that's a very good question, because let's suppose you offer a chaperone, you have a nurse available, nurse is okay to stay in the room, but patient says, oh, I don't need it. But what if any kind of allegations happen later after to you? So explain the role of the chaperone as an observer to ensure that patient feels safe. If the patient still refuses, consider deferring a non-urgent clinical examination or referring a patient to the healthcare provider who will perform examination without a chaperone. Why we are saying this? If it's a non-urgent, you don't want to take a chance that in future this patient will make a complaint to the college regarding any kind of activity against you. That's why if it's non-urgent, it's just the pap test, which is scheduled pap test, and the previous 3 pap tests came negative, you don't have to worry about it at the moment. You'll say, okay, I will do it some other day when your family members comes here or someone is here. Or maybe you can say that, okay, I'll send it to my colleague, she usually do it without chaperone, so it's a good and comfortable procedures. So I'm not comfortable doing it without chaperone. The reason is you are saving yourself at this point of time. You are not mandatory to do an examination without a chaperone being offered, chaperone being present in the room, because patient refused to do that. If you don't feel comfortable, there is no pressure on you. So it's not mandatory for a physician to do an exam. If patient says, oh, I don't want a chaperone, just do it. No. Make sure that the patient understand the potential consequences of deferring a non-urgent examination. The reason is you have to tell them that I don't feel comfortable, because it is very important and it is very common that sometimes people with having any kind of previous bad experiences with the healthcare system, they they put allegations, and and the physicians face allegations at some point of time because of not explaining it procedures or something like that. If a physical examination is necessary to address a urgent or an emergent condition, the patient does not have the consent to the chaperone being present, it is generally advisable to proceed with an urgent examination. If it's an urgent or emergency, yes, go for it. Document the chaperone presence and the patient's consent or refuse in the medical record. You have to put in the documentation what was happened, if the chaperone was present, absent, why the absent, because patient refused it, or some kind of thing. Second and the last topic of this video is sliding slope, slippery slope. Boundaries crossing do not always cause immediate or obvious harm to the patient. However, repeated crossing or progressively bolder minors once may become a slippery slope and resulting in more serious boundary violations. Boundary crossing is not harmful, but repeatedly boundary crossing could be slippery slope and go into the heading of boundary violation. Romantic relationship. Romantic and sexual relationship between physician and current patients are inappropriate at any stage. If they are in your therapeutic relationship, you cannot make any kind of romantic relationship. Therefore, forbidden due to the power imbalance, even if the patient's concern or initiate a sexual relationship with the physician, it is considered sexual abuse and it is forbidden by the regulatory authorities. In instance where romantic relationship and sexual content start after the doctor-patient relationship has ended, the physician may still have to be found a commitment professional to have committed professional misconduct. In determining the propriety of romantic or sexual relationship between a physician and a former patient, because now you are not taking care of a person as a patient, a number of factors will be considered that may include the length and the nature of the relationship, the extent of which the physician receives psychotherapies, if any, and vulnerability of the patient. If patient was vulnerable while they were in the your care, even though you end up the relationship, you cannot make a sexual relationship or romantic relationship with them. Let's suppose if you were a psychiatrist or you were providing psychotherapy, no, you cannot do it. Even though that patient is now your ex-patient, you are not seeing that patient for 5 years, no. If the patient is not vulnerable, then there are some kind of check marks you have to look for before you say that, okay, I'm in a relationship with that person who was my ex patient. Physicians should be familiar with the college guidelines and policies on boundaries. For example, some college guidelines on a specific time period requiring between formal termination of doctor-patient relationship and initiation of the personal one. Some college also stipulated that in certain circumstances, if psychotherapy was provided, it is never appropriate to enter into personal relationship with the former patient because of their vulnerability while they were in your care. All the colleges have zero tolerance with respect of sexual abuse. If you are in doubt whether beginning a romantic or sexual relationship with a former would be a boundary violation, you may wish to seek the advice from Cmpa. Dual relationship, professional and social. Physicians may well have patients with whom they socializing or their friendships. Many physicians, particularly those working in a small communities, will have the patients in their social networks. It is very difficult to maintain a strict professional boundaries when the patients attend the same religious institution, shop at the same store, eat at the same restaurant, attend the same social functions, or play in the same sports. These issues can be challenging for physician. However, it is responsibility of a physician to maintain the appropriate trust, respect, and boundaries. professional boundaries. In these cases, physicians should still be conscious of the potential of boundary crossing as much as possible, separate their personal and professional obligations. The closer the relationship is between the physician and patient, the greater the risk of perceived boundary violation. Yes. Question you can ask yourself to assess whether boundaries are being blurred, including during a clinical encounter, do I encourage conversation about non medical or social activities for my personal benefit? How do a neutral observer view this arrangement? How does could the patient view this? How do I feel I must keep social interactions with the patient secret? This is very difficult, and it is something you need to question yourself. It is a very broad topics because most of the physicians who are working in a small community, they have these kinds of issues. So you need to understand that you cannot uh, you have a blurred vision or a gray zone between the personal and the professional boundary, or a social and a professional boundary. So that needs to be understandable. Treating families and close friends. Treating family, friends, and staff may compromise patients' physicians' objectivity and judgment. Of a particular note, consider that most colleges have policies regarding prescribing medications to the families or close friends, especially narcotics, controlled drugs, substances, monitored drugs, cannabis for medical purposes, or any drugs or substance that are addicting or habituating. Most colleges have policies that prohibited physician from treating or prescribing medication for family member except for minor conditions or in emergency when another healthcare provider is not available. If ongoing care is required by family member to the or close friends, should be referred to another healthcare. We know that we cannot treat our family or close friends. We cannot provide the things which can be addicting like pain medications or narcotics. You can give them some kind of a things which are either very minor conditions or which are in the emergency situations. Emergency situations means the physician of your partner is not available for next 2 weeks and she is running out of a thyroid medications. You can prescribe it for 2 weeks until the physician comes back. Minor conditions, anything which is emergency having to be treated at this point of time, there is no doctor available, the family physician is not available, you can provide the treatment, yes, but not an extensive or a larger period of time. Business transaction. Physicians should avoid entering into business deals with the patients. Dual relationship with the patients can result in conflict of interest, lessen clinical objectivity, and ultimately may impair clinical judgment. Due to the power imbalance between physician and patient, patients may feel pressure to enter into a personal transactions with their physician out of the fear that refusing might jeopardize the relationship with the physicians and the quality of care they received. This is very important to understand that even though in a physician patient relationship we are in a therapeutic, we are trying to be equal on all stages, but at some point of time the authority or the dominancy of the physician comes over the patients because you are basically having a lot of personal information of the patients and you might have the authority to use it in any way. So that's why patient will always be pressurized, and when you are trying to go into the business transaction or any kind of financial kind of a thing, it will be very difficult for patient to stay in that professional, and it is never being advised or never being done by any physician. Let's suppose there is a case which I read that a female who is looking for a job, she's not getting a job, she has a kid, she's not able to help herself and financially, then physician says that you can do work at my home like cleaning and cooking and other stuff, and I can pay you the salary so you can able to support yourself and your family. This type of thing is not something should be done because it's a violation. Why? Because you're trying to ask the patient to do your job, you will pay her, that's the outside the relationship of therapeutic, but at some point of time that patient will feel pressurized. Oh, if I'm not doing it and I'm going to the doctor, he or she might not give me the medications, he or might get angry at me that I was not available for 1 or 2 days. Anything could be like that. So you cannot enter into that kind of financial stuff relationship. You can only state that, you can say that you can give an idea that okay, try to do some kind of stuff that can help, but you're not going to give a job to your home address. This is not applicable. especially when there are your patients. Power of attorney request from a patient. Physician may ask to act as a patient's power of attorney. In most cases, physician should respectfully decline these requests, especially when another suitable individual is reasonable available to take the roles. They are saying yes, you have to respectfully decline these respects request, because you cannot be someone's power of attorney any kind, anyway. The self-disclosure, while it may be appropriate in some circumstances to share your patient limited journal information about yourself, for example, a favorite sports team, the fact that you have a pet, is generally it is generally improper to disclose personal information or share intimate details about your personal life, like relationship, financial, and health problems. Sometimes it's okay to say, oh, you have a cat. Yes, I do have a cat. It is unacceptable for a physician to discuss their sexual life or sexual relationship with the patient. Note, only can divulging intimate personal information make patients uncomfortable. It can lead to the patients to misunderstand the nature of the relationship and see it as a friendship rather than a purely professional. Yes, when you try to involve your personal excessive information self-disclosure, patient will feel like, oh, we are getting a friendship relationship, we are not still being in a therapeutic relationship. Gifts after receiving care, it is not unusual, that means it is very usual for a patient to or their family members to thank the physician by giving gifts. While such a gesture is often benign, there's no kind of a gain or a continuous kind of a thing is happening, it can become a boundary violation when that is being crossed most of the times, or a lot of times, depending on the circumstances and the nature of the gift. Accepting gifts or the financial benefit may create an expectation that the patient will be afforded a special status and the favor will be the reciprocated. That means whenever you are trying to receive the gift every on each visit of the patients, then that means you are accepting it. So patient will understand, oh, now physician will give me a favor whenever I go 5 minutes late, 10 minutes late, even though they have a policy they will not see me, but he or she will see me because I have given a lot of gift to them, they can do a little favor to me. That's the one thing. Other than that, if a gift giving is a part of a pattern of a behavior that suggests that patient is looking for a more than just a professional relationship with the physician, or if the gift is are inappropriate or expensive, it is wise to talk about it with the patient. As I mentioned, that whenever patient feel a hint that no, we can go more than the professional relationship, or the gift is too expensive, then you should not accept it even in the first place. Physician should explain it is inappropriate to accept gift for medical services or to form of a personal relationship with the patients. When a patient offer a gift with significant value or give multiple smaller gifts, physician should sensitively explain why the gift cannot be accepted, and these discussions should be documented in patient's medical record. These are many things which will be understandable when you are trying to answer a questions. This topic is very important because my understanding is these kind of things are very gray zone, and you need to understand where you have to cross a boundary and say, okay, this is the thing which I'm not going to do, even though it will maybe upset the patient, or if patients will feel like, oh, doctor is not giving me favor or something. But it's still ethical part of the practice comes first. So this was all about today. Let me know if you want to read me something else, or I should continue reading the good practice topics. There are multiple topics which needs to be studied before you go for a QE1. So cultural safety, privacy and confidentiality, and all of these topics, if you go and open all of these, there is a lot of topics to read. But these are very important because your scenario based questions will be coming from somewhere here. They will not give you exact statement which is written in Cmpa, but yes, questions can come from these types of things. See you next time. Good luck with your exam, and thank you so much.